Hello, everyone, and welcome to Public Health Musings. I'm your host, Dr. Caroline Kingori, a faculty member at Ohio University. I'm so glad you're joining me today. This podcast episode is sponsored by Okera Coffee. Why not treat yourself to a delicious cup of coffee while you listen to your favorite podcast? Get premium, freshly roasted coffee beans delivered to your door. You can use the following codes: SAVE10, that's SAVE 10, one word, for your first order, or SAVE16, SAVE 16, for any 3 products for a special offer at checkout. Elevate your coffee experience today. Order at shopokeracoffee.com, SHOPUKIIRACOFFEE.com. So I have a treat for you today. I am so excited. As you can see, first of all, we are live for the first time ever. We're doing this face-to-face. And I'm joined here by my new friend, Stephanie Moxley. So excited you're here. And she's the CEO and founder of Moxley Public Health, which conducts and writes community health needs assessments and improvement plans for hospitals, health departments, and other organizations. She has been in the field of public health for over 20 years. That's amazing. And she has worked on several projects, both at the local and federal levels. She's committed to a career focusing on health promotion and addressing health disparities and inequities, and to improve health outcomes in our communities. She's well-versed with the research methods process, with collaborating with communities, and I can't wait to learn more about what she's doing with her consultancy and her organization, and just her overall experience with public health. So join me in welcoming Stephanie Moxley to the show.
Thank you.
I'm so excited you're here today.
I'm excited to be here. I love driving to Southern Ohio. So we discovered the reason we're in person is because we're both live in Ohio.
Exactly.
So that's exciting. And we were very excited when we discovered that.
Yes.
And I also want to say that I am a customer of Okera Coffee. And I was very excited when I got my first order in the mail. Yeah. And you told me something really interesting that I think would be that everybody would love to know. What does Okera mean? And tell me about the name. Well, the origin of the company, but also the name was really cool. I didn't know that.
Oh, thank you so much for asking. So Okera Coffee is derived from a need to enhance our grandfather's legacy. My grandfather, Moses Mokera, who was also a community leader, and he's a senior chief, a while back, many years ago, and he has since passed away, but he left us with a legacy of community engagement, leadership. He was an avid coffee and tea farmer. And so my cousins and I, a few years ago, we were sitting around and we're like, who drinks coffee? And, my cousin had given us some coffee there at her house. She had called us for a nice meal. And we're just having a great time. And we thought, hey, how about we start a coffee business and do this in honor of our grandfather? And we just started, spewing out names and what we need to do. And we're getting excited. And the name Okera Coffee came up. Actually, I recommended that. And because of my grandfather's name, Okera, we thought, well, coffee is all about invigorating you and energizing you. Mm-hmm. And in our language, Kikuyu, we thought, well, Okera is wake up.
I love that.
And so we just removed the M from my grandfather's name, and we added an extra I just for the fun of it and for branding purposes. And so we called it Okera Coffee, and what it does is just give you this feeling of freshness and feeling awake and feeling alive. And
I literally go to bed excited about my coffee the next morning. I'm a real coffee drinker. So, and I think it makes, it's very good coffee, but I also think it makes it taste better because I know the story behind it and it's meaningful. Yes. It makes it more fun to drink.
And it's been a journey. So this was since 2020. And it's been a journey, and we just launched this year. Mm-hmm. And we are doing this online. And we are hoping to grow and eventually own the whole supply chain. We do have coffee farms in the family. We're selling coffee from the farm as well as other farmers in Kenya. And it's not like it's scary, but the fact that we are honoring this great man just makes it all the more exciting, knowing that it's not just about selling coffee, but about just putting the word out regarding what my grandfather did and who he was. And he was such this amazing individual that you can't even just put him in one like a way to describe him just one way. He was so many things, and he was passionate about faith in God and about hard work and about family. And those are the values that he's left us with, and we find ourselves also just gravitating towards that. And we just celebrated a few graduations last weekend and this weekend, and he would have been happy. And where he is, I know he's smiling.
I feel like coffee for me, it encompasses it's just very meaningful. It means a lot it's a big part of my life. And it's also a big part of community, which we're going to talk about today. I feel like meeting somebody for coffee. We're having coffee together now, meeting a friend for coffee. Right. I met a potential client this morning for coffee. And, it's just, and I told them about Carol also. About advertising for you.
Correct.
So my other job might be in marketing.
You're fantastic. I love meeting you. Yeah, Stephanie, and learning so much about you and your energy and your commitment to the community. And it was great that we can have this conversation today over coffee.
Yeah.
and just talk about community and public health, which is our shared experience, and obviously drinking coffee as well. So now that you know my story halfway, what's your story, Stephanie? Like, why public health? Who are you? And, tell us more about why you started a consulting business.
Okay. So like everybody else, we knew that it's hard to condense our journey down. So public health, when I was an undergrad, I used to think this was unique, but it turns out it's everybody. A lot of people in public health, that I was a pre-med major and then a nursing major. So I did know that in my heart, I cared about people and I wanted to care for people and I cared about their health. And so, but like also a lot of public health people, I didn't have that terminology yet of public health. So I only knew to be a frontline worker. So I ended up moving to New York City in the middle of undergrad. And I finished in sociology, which honestly at the time I thought was sort of a cop-out degree, but it really wasn't. I think it was very much a part of my journey, very much me. It was a great segue into public health school. So I finished, I like it because I learned about people. I enjoy learning about people to this day. I love, documentaries. I'm talking to people and hearing their story. And so I got a job doing HIV prevention with adolescent females in the South Bronx, New York. And part of that, honestly, is I do not remember applying for that job, which is still another thing. But I got it in the acceptance letter, basically, or the offer letter in the mail. We had email back then, but we were still getting a lot of stuff in the mail, So somehow I think the offer letter came in the mail. And I accepted the job, of course. I was really excited. It was my first job. And so I started that job, and that is what took me into the field of public health. There was a woman there named Candia Richards that had a master's in public health. And so over time, I worked there for a couple of years, that she, along the journey, to help me, encouraged me to go to graduate school for public health. So I did. I went to Boston University School of Public Health, and I was the HIV fellow, co-president of BAM, which is Public Health Alliance for Minorities. So right out of graduate school, I got a job, as we all just are job searching out of school, and I was a consultant at John Snow Incorporated. Oh, nice. Do you know?
Yeah, I know that.
Okay, because some people do.
Yeah.
And I was very excited. And I was sort of, I don't really know how this happened, but I was in the role of evaluator. So for years and years, I was an evaluator. program evaluator and monitor. So that's what took me into the field of public health consulting. I worked there for several years. I did lots of projects from the local level to the CDC level. But honestly, what I loved is I liked working with communities. I just really did. I don't know what it is. I like, it felt intimate. It felt like that's really where change is made. So I worked in the Boston office, and then I worked in the Denver office because I moved there. But honestly, I ended up leaving JSI because I was having babies.
That's a good reason.
Yeah. And so when I left JSI, though, I started consulting on the side. So in order to get paid, you have to come up with a name for your company. Moxley Public Health. And that was come up, about 20 seconds, that name. But I didn't really care. I didn't put much thought into the name at that point because it was just, I don't know, you had to do it you had to be an LLC.
Right.
So I was the contractor on several projects, and I consulted all the way. So I have 4 daughters, and I consulted all along. But it was very part-time. And to be totally honest, it was kind of at that point, it was sort of backseat to the girls. But I was doing needs assessments, but for program work as an evaluator. So about 5 years ago, I was doing a really cool project with Partners in Health. Have you heard of Partners in Health?
Heard of them.
And I was doing adolescent mental health trainings for an area in Haiti. So it was really, just super cool project. But at that time, I was talking to other consultants because I knew it was my time I really wanted to bring my career, my professional life, kind of up front a little bit more again.
Yeah.
And so I knew it was like my time to pivot. So I was thinking about a lot of things. I worked with Dr. Huntley.
Oh, yeah.
Charlotte Huntley.
Yes.
And she was my business coach. And then I'm talking to other consultants. So I started learning about community health needs assessments and improvement plans with hospitals. Dr. Huntley said, I know this sounds crazy, Stephanie, but if you want to scale, niche down.
Oh, okay.
So she was the first one that gave me that advice. And so I thought, well, that's crazy because, would I do better if I was a journalist? I could do it all. And so I niched down. And also, I was also thinking through, do I take a job at a health department or sort of a 9-to-5 job?
Right.
And so when I decided that, no, I want to commit to the consulting, stay on that track, I was really just trying to get a couple projects to replace a salary, to be honest. I thought, well, this is what I could make at this job. Okay, how many projects would I need to replace that income?
Right. So,
and I was kind of a one-man show. So I had some subcontractors and a graphic artist and things that helped me. But basically it blew up.
Wow.
Yeah. So that's what happened. So a couple years later, I've hired. We have 4 people that work on the Project Plus, an internship program.
Nice.
Yeah.
Yeah.
So, and also women, all women. So that was also by accident. I love supporting having a women-owned and operated company. I love men, but I love progressing women, and I love being involved in that and contributing to that. And we have a really fun team. And then when we did the internship program, we just were out to hire one intern, and then we had 200 applicants. And so we created the Women Supporting Women in Public Health internship program, and it's great. So
no, it's incredible what you've been able to achieve to this point. Talking about female-run organization, similar to what we're trying to do with the coffee business. And you highlight it. And I just want to let everyone know, even with this talking about coffee in this podcast, it was her idea. And Stephanie, unbeknownst to her, she has great business ideas, even as she runs her consultancy. And I just wanted to recognize
Thank you.
and to appreciate you.
Well, I'm really good at coming up for ideas and telling other people, business ideas and how to make money. So
I appreciate that. And giving me the,
people are for me.
yeah, and the idea to do this even, as we're talking face to face. It's the first time I'm doing this. And I was like, how's this going to work out? And it's good that you pushed me.
I think our conversation went really long before we met. And then we were emailing all night. We were so excited that we met.
Right. So I appreciate that. I've had one other friend who's like, use your podcast. And I was like, okay. And you just were like, you were the pushing.
And it seems natural to use the podcast, like to talk and drink coffee. So that's my jam.
This is so cool.
Mm-hmm.
And so as we talk about communities, your passion for working within communities is obviously evident, and it radiates in you. And so could you share an experience where you successfully filled a gap or addressed a specific community need, highlighting that power of collaboration and relationship building? And I think that's something we want to emphasize when we talk about public health, that it's about working with communities and not doing unto them, but working with them because they know what's best for them. They know what's bothering them. They know what's important to them. And so if you have just one or two examples you would like to highlight.
So first of all, I think I was just broadly, I love community work because we all live in a community, or most of us anyway. So we live off the grid. Right. We all live in a community.
Right.
And as I'm doing my work, I can't tell you how often, of course, I haven't walked in all the shoes that other people have walked in, but so often I'm able to personalize things because we all experience that. And, I had told you that, lots of stuff. My mother passed away of heart disease a few years ago. And I think about the services that, could have prevented her death and around heart disease. So I think heart disease is always a major health need in communities. So of course I think about that.
Right.
I think about mental health. I think about the fact that I had to drive an hour to go get a mammogram, and I made that decision, but somebody else might not be able to make that decision, One story that I have shared before, I think I did a LinkedIn post. There's lots and lots of stories that have touched me when we're doing our work, but one that always comes to mind, actually, I was talking to a college president in Southern Ohio.
Oh, wow.
And so I was doing a community health needs assessment for a health system. And part of the process is we talk to we call them key informant interviews, and we talk to a lot of community leaders in the community. So he shared a story of a young woman. So one of their big programs is nursing. The nursing program attracts a lot of parents, young parents, maybe they're already parents. So it seems like a lot of people have younger children and they're going for their nursing degree. So he shared a story of a young woman who was a great student, really promising, very, just would have been a great nurse. And she had to drop out of the program because of lack of childcare. And so I do share that story. A lot of times clients are like, why are you assessing childcare?
Yeah.
This is childcare.
Right.
But it not only affected, obviously like her, but her children's life. She came out of what I understood, generational poverty.
Yeah.
And so that could have been a trajectory of her life that really changed her life, her children's life. Also, there was a major medical profession shortage in this area.
Yeah.
So it would have affected that because she probably would have stayed. I think she was like somebody who was really rooted to that area. She would have stayed in that area, contributed to that, contributed to the economic stability of that community. So that really hit me. But the good news is, because of the data and having the conversation, this school is working on, because this just happened in the last year, they are working on getting funds from the state so they also have an early education program to have childcare right there. So the students in the nursing program and other programs can bring their child to school, have the childcare right there. And that's an example of, was that the health system? No, but that was a leader in the community. And because of that, childcare was addressed. The nursing shortage was addressed. Economic stability is being addressed. And they're making a change at the school.
Yeah.
And so that's exciting. While that's very a sad story, that's a success story too of this work.
And I like that example because it highlights again what we see in public health, which is the multifaceted approach of looking at health issues. Here's an individual, right, who dropped out because of childcare, but that translates to what's happening in the community and the shortage of nurses and bigger issues that become a policy problem. We need funding to have this on campus or daycares where our community members are doing their professional development work. And that's something I try to emphasize in this podcast, is that public health is not just about an individual. It's about the community and how things that are happening in the community impact the individual, and things that are happening at the individual level impact the community level, national level, global level. So I appreciate you for sharing that experience. Could you also tell us more about your experience in collaborating with clients to design and implement those community health needs assessments? So maybe describe what a community health needs assessment is, and then how do they translate into improving the outcomes in the community?
Okay. So what do I want to address first?
You can tell us, what is a community needs?
Okay. So first of all, though, what I was thinking when you were talking before is even if a community knows what is going on, which they also have questions,
right?
But you can't do a whole lot without data, to get attention. It not only informs the community of what's going on and the issues and the health needs and what the whys and the causal factors, but it also will get, even if the community knows what's going on already, it gets them attention. It's like that college. Yeah. They needed that data to get attention, to write to policymakers. That's how we're doing a needs assessment in a community in Jamaica that I love. And it's a long story, but I did my internship there,
Good job.
A long time ago, 20 years ago.
Oh, wow.
And we've stayed connected. But one of the reasons there, I'm sure, they have things to learn, but it's not that they don't really know what's going on, but they can't get attention and get help to their community without that data to give them attention. So, so community health needs assessment, what it is.
Yeah. So
basically, it is, I think of it as the first step of evaluation. And so you shouldn't, you don't want to put all these resources, all this time into an initiative or intervention if you don't know what's going on. So one, I'll explain a community health needs assessment. So what we do at Moxley Public Health, now you can assess mental health. You can assess a specific area or a population of people. But for the community health needs assessment, we do 20 to 30 health needs, and half of those are social determinants of health. So employment, education, access to childcare, access to primary health care, access to mental health care, dentist, transportation, economic stability, and so forth. And then the other ones are sort of what you would think of: heart disease, diabetes, maternal and infant health. So we assess all those health needs, 20 to 30 of them, and we start with what we call secondary data collections. So we see basically what's already out there with information. So the CDC, county level data, everything we can find for each health need.
Right.
And then we go into primary data collection. So that is the fun part, and that's where, if you haven't realized, I like to talk. So
it's a good skill.
And so that is where we really just get it. It's not, community health needs assessments are not dry there, because we got to do interviews with community leaders, focus groups, develop a survey. And so then we take that data, and that's several months of collecting that data.
Right.
And we write a community health needs assessment. And a community health needs assessment is basically for an organization or hospital or health department to say, okay, this is what the data says. This is what our community says is really important. Let's prioritize our health needs. And one of the reasons that we have to, no matter how big the bucket is, basically of how much money we have or the resources, everybody has somewhat limited amount of resources. So they prioritized health needs. Okay, this is what we're going to focus on. And also during that, they didn't just learn, like, we rank health needs, but also it's about the why, what's going on. So mental health is a great example. Mental health is basically always, if not number one, the top three health needs in a community. So that's not new. Maybe that community already knew that. They probably did. But where a needs assessment and where our work is also really important is finding out the why and asking the right questions to the community. So for instance, if you see that mental health is an issue in a community, you might say, okay, well, we're going to hire more counselors and build this, behavioral services building. And that, like for a community that we're working in now, that is not, the access is not so much the problem. It is there, but it's the stigma. So when you know those issues, then you start to, that informs the programs and the interventions that you put in place. You asked about collaborations.
Yeah, no, I like that. And I think it's important how you said you have to go to the ground and talk to these people. You have to go to these communities and understand what are those needs. And sometimes it's not just what's lacking. It's not just about the gap. It's like, what other resources do they have? And how can we build upon those resources while trying to address these gaps that they have? So the question that I asked was, how do those community needs then contribute to improving?
I ramble so much that I forget what I was answering. Okay. So one thing that we're really proud of at Moxley Public Health is that we're really trying to raise the bar on collaboration and fostering partnerships. So if we're working with a health department or a hospital, health system, we start by, here's all the health needs. And the first thing is who we're going to interview. So that starts with, we're going to go to the community, we do focus groups and surveys, but it starts with interviewing the community leaders. And we make a list, hopefully, covering all the different health needs. And through those, I will tell you, while we get a lot of information, that data is really good, we also get buy-in. And we start to talk to people.
There you go.
And people love and are excited to talk about their community. And then they are also bought in to this work, the community health needs assessment. And so that is the first part of creating strong relationships and support to the client. Not so much, not just to us, but, mostly to the client. And and also we might, when we look at the list, we also have them look, and that's where we start to identify health disparities too, or improve health equity. So we have them take a second look at that list.
Nice.
Does it look like the community? And so we want to talk to people that look like this community. So that's what happens with the list. But it's also, we move into the very end of the process, going all the way to the implementation strategy or the improvement plan. Those are the same people we talk to that are at the table and saying, okay, so it's not just the health department or hospital. These are the priority health needs. What are we going to do about it now? And all those partners start to come in. So we like to say at Moxley Public Health that many hands make light work.
Yes.
That we've got to stop working in silos. And everybody's coming together to do several things to address health needs in the community.
And I like that response. And you mentioned when you have done this health needs assessment and you've done that first part of seeing what matters, what's lacking, what's there, then you have this health improvement plan, right? So walk us through that process of planning, doing that health improvement plan. You're like, communities, have we captured everything that matters to you? So what is a health improvement plan, right? Which is as a result of that community health needs assessment. And how do you execute that so that it makes a difference in the health outcomes?
So again, we've done the CHNA, we've collected the data, we've done the focus groups, we've talked to the community leaders, we've done the survey, and we made this report. And so first of all, during that report, we put a big emphasis on data visualization, which we're becoming kind of popular for. Because first of all, the community health needs assessment was made for the community. So I don't care though if you have 4 PhDs in data analysis, nobody likes to read paragraphs, stare at a table.
Right.
And so with our data visualization, we're able to make data, communicate data, make it understandable to everybody in the community, including good data visualization with a lot of text is accessible to more people if there's low literacy levels or if English is a second language. So we look at all that data as a community. So the first thing we do, we have 2 meetings. So we send out the community health needs assessment draft to community members to take a look at it. We have a meeting to decide on the priority health needs. So we have criteria about that. So, you look at what you did last time. So what you did like a couple years ago, what you focus on, do you still want to focus on that? And so and that's always, everybody wants to talk about everything they're going to do. I'm like, nope, our objective for today is just to think about what is the community telling us? What does the data tell us? And with stakeholders from the community, we make these decisions. So first we decide our priority health needs. And then at our next meeting, we meet with all the community partners. So everybody I was telling you about, we bring everybody at the table. And one thing that, so they're already a lot of communities now have sort of a health coalition or a health collaborative. But we have been focusing a lot on bringing other people from the community that they didn't think of. So for instance, the landlords, housing is a big issue in communities. So landlords of housing, because if there's some policies or ordinances made around housing, so it's safer and cleaner, they might get ticked off. But it is magical if you bring somebody to the table and start talking, how people completely turn into one of your biggest supporters.
Oh, wow, I like that.
Yeah. So bringing other people to the table to talk. So we bring all those people, all the community partners, the landlords, to somebody from Job and Family Services, from a clinic, to the mental health boards, somebody from the YMCA. We say, okay, so here's the health needs that we focus on. So what are we going to do about it now? And everybody starts and on their, the programs that they want to implement over the next few years. We do that through usually on Zoom, and then we have sort of a live document where everybody's typing into it. But that we also create a work plan from that. So what I was finding is that a lot of clients, they said they were going to do all these things in their community, but they didn't do it. So we break it down to details and we talk through a plan of checking in and creating accountability and taking baby steps to those strategies.
I like that perspective because we know and we are governed by plans and order of a certain level, but in the community, they are leaving out these issues and trying to say, okay, here's what you can do. Take 5 glasses of water. Sometimes it doesn't translate. So I appreciate that you are able to hold them accountable, but also be this hand that they can hold and be supportive. And I think that's where that collaborative spirit comes in.
And making a plan for it. I think that is where the success comes in. Again, we do all the heavy lifting, I like to say. So hiring us is like, we'll do all the work. But the client owns the data. They live in the community. All the community partners in them are the experts. We're just telling them we do the hard work, like the writing, and we facilitate meetings, but they're informing everything. But we're just sort of telling them exactly what to do and what is next, and how to do that step. So,
and that's awesome. The fact that they have a voice in that plan makes all the difference.
Oh, absolutely.
And it's something public health has become better at, this community-based participatory approach that in the past we came in like, oh, we know what's best for you. Oh, the CDC says this, or this organization says that. And it really put off communities and alienated them. And that's not helpful.
And it's tempting to do that. It's tempting to, I think with maturity though, in an industry that you realize that you're not the expert.
Correct.
And to learn to listen.
Right. There it is. Learn to listen. Like we can literally end this here. Learn to listen.
Learn to listen.
So earlier on, you mentioned how community needs assessments help with developing evaluation plans. And I like how we're just going really well. You collect this data, you come up with a plan, and then you implement, right? Those strategies, whether it's people need to eat healthy, whether you need places where people can walk, or all kinds of plans that are out there. So evaluation does play a key role in assessing whether those plans are effective and where they're at and what needs to change. So how do you approach creating those evaluation plans, and then how do you bring in the community?
So I was an evaluator, as you know, for many years. And so I think it's great that I can put on my evaluator's hat when we're doing this work, because it really is. It's very pure, needs assessments. It is the first step of evaluation. So during the all along in the community health needs assessment, but when we have selected priority health needs the community has, we write at the top of each section, here's the indicators that we are choosing for this health need. So if it's suicide, it's number of suicides over maybe like a 5-year span in that county. And so that's kind of an easy one, because of course you want that to go down. So at the next 3 years, 3 years after, they hope to see that suicide has moved. And we do that for every health need. Choose indicators. We also look at National Healthy People 2030 objectives to kind of see if we're moving towards the goals for the nation's health. So if there's Healthy People 2030, I think it's collected every 10 years, or they make them every 10 years. And basically they have goals around, so for, I think that, for maternal infant health, it might be something around that, I don't know the percentage, but X% of women are receiving prenatal care at, by a certain amount of months. So we collect that for the county, and then we see where they are 3 years later.
Right.
The community, we also really hope that it's monitored, over in between,
right,
when we come back.
Right.
And another part of that is that, because I wear my program evaluation hat, a big part of that is monitoring too. So which people forget with evaluation. And that's just to make sure that you're doing what you said you were going to do.
Correct.
And that's where the work plan that we create for clients came into existence. It's not really necessarily part of, the service that consultants like us in the CHNAs and implementation strategies offer, but we really wanted to break it down so that clients and communities can be successful. And that is a part of evaluation. So, it can be very specific. It can be like, Sandy so-and-so does the training. This is the room that she's going to do it in. Because if those specific goals, baby steps of the goals are not decided, it's probably not going to happen.
I like that.
Yeah. So,
and it's true, because often we just look at evaluation. Oh, was this effective? And even as we teach our students, we say, you have to capture, and there are all these different levels of evaluation, whether it's outcome or impact or the process evaluation. And I think that's where the monitoring comes in. And it's important to capture and to be willing to make changes as you go along.
Yeah, absolutely.
And that can be challenging, as you know, especially depending on the funding and depending on the flexibility of the team. How have you addressed challenges in the evaluation process for yourself?
So again, what's tough is that right now we're contracted to work with clients, I don't know, 7 to 11, I don't know, something in that range months to do the CH&A process and then the improvement plan of the implementation strategy. And then we say, bye, hope all goes well. I'll see you in a couple years.
Right.
And that's the case just because of resource, whatever. But one thing that we have done is we make, like I said, over and over, I've said this, we make the work plan.
Good.
And then we talk through how they'll implement the work plan. So what seems to be kind of working with a lot of clients is very natural to have like a quarterly meeting with all the partners coming in. So they'll talk about the work plan. They'll basically go by organization
Right.
and go through the steps like, hey, and Q3, you were going to do this. How is this going? And it creates accountability. It creates, to talk about it. So somebody is leading that. Usually it's from the health system or the health department. So somebody has to lead that initiative, but just even talking through that and making the plan that, okay, they're going to have quarterly meetings with all the partners in the community. It seems common sense, but it wasn't happening. And it doesn't happen in a lot of communities that they at all talk. And that's where the plan was falling off, because they weren't communicating. Sometimes just communication and talking is huge. And one of those, around collaboration and being successful is just regularly figuring out that referral guy. So a lot of communities, so like you said, it's most of the time it's, yes, we want to create new programs, but it's using resources and organizations that already exist.
Yeah.
It's just they would be good or they want to add to a program or but it's amazing how many communities I talk to that they'll say, oh, shit, we need this. We don't have this. And then another partner says, actually, we do that. So just even communicating about what everybody's doing is huge.
And I've learned over time, that's why we have sort of this duplicity of services or duplication, because people don't talk.
Mm-hmm.
But also they don't know how to start that conversation. There's also the fear of some sort of competition. Oh, we want those funds in our community, so they won't reach out and see what the next county is doing because they do want their own needs met. Yeah. But there could be some synergy in knowing what someone else is doing and learn from them, but still be able to solicit those funds. What do you think?
Yes, I think that we get a little competitive, by nature, but the reality is even with our work, I think there is plenty of work to go around and plenty that needs to happen in a community.
Right.
So if, somebody is competing to two organizations that serve substance use community, they could probably both do the work and be successful. And a lot happens when people work together.
Boom.
So, I have other consultants, honestly, that do exactly my service.
Right.
Community health needs assessment. First of all, think about how many health departments and hospitals there are in the United States of America.
Right.
There's plenty to go around.
Right.
But we share ideas.
Yeah.
Our work is so much better because we talk and we share ideas and we come together. My company has gotten so much better, not just because, of course, it's wonderful when, because of the workload, more people are in it. But honestly, the magic that happens is that there's several brains in the mix. And there's different ideas, there's different perspectives that we didn't think about, not because we don't care, but because we didn't think about it. We haven't walked in those shoes. So
I like that. And that brings me to this question about networking, right? Because it's only when you communicate, then you get to know what everybody's doing. And it's sort of your way of building this network, this resource. So you're a master networker, you're people connect.
I don't know if there's a certification for it, maybe I should get it. But,
yeah. Oh, I can see that. Since we first met and started talking, so much, has happened, and all the ideas we've shared and the things that you've told me, just fantastic. So can you provide an example of how you've used your networking abilities to bring individuals together and also, to the benefit of the community and improving those health outcomes?
Yes. So I need to think for a second on a specific example, but I guess I already talked about it. That we bring. I like to talk, and that's why I love the primary data collection of focus groups and interviews. And we really take a lot of pride in bringing people together. So I think I talked about that already, that we really, bring all the community partners together and encourage collaboration, encourage them to talk to others. And that also, that came by accident, that we were seeing like, oh, there's a big gap here. And we started encouraging them to talk to each other and invite more people to the table.
Right. And I think it's getting them to that place where they can trust the other person.
Absolutely.
To talk to them and talk about the health issues with those thoughts that we've already said. We need these funds in this county, in this city, in this health department. How do I know that person won't take my idea?
And I've been saying that for all areas of my life, that I want to write a book someday about, like the 5-minute. If you talk to somebody for 10 minutes,
right,
it's amazing how, maybe you're having conflict with somebody, and if you can just talk, you probably can come to a good place, and communicate where you're both coming from. And so much, and we all can learn that, whether it just be in our families or friends. Usually we just talk, you come to a place and you see both sides, and then you have a whole different feeling. And the same thing happens in community health needs assessments and making improvements to a community. When a community comes together and they work and they see where others are coming from, they have ideas to work together, they didn't know about. And, I always say that I think we said this, like the amazing things in my life and a lot of amazing things that happen because I talk to amazing people, and we talked about that day, that things come my way because I invite amazing people into my life. Right. And so hence, amazing opportunities.
Yeah, definitely. I've learned so much, and you've given me amazing resources to continue learning more about connection and networking and telling stories. And public health is really half of that. Communities tell stories.
And that is another, just to talk about our data of, so there's quantity, but just if listeners aren't familiar, there's quantitative data and qualitative data. And so a lot of our data is like numbers that would be like, secondary data, or, 75% of people, in the community said this on the survey. But we have a new rule at Moxley Public Health that we always pair qualitative data and quantitative data next to each other. So if the data is telling us, I'll go back to the suicide, there's a high suicide rate in a community, somebody is telling a story or a quote next to it. And it's much more powerful that way. And like we talk a lot, people don't remember numbers, but they remember stories.
Correct. Yeah. And it helps contextualize that and humanize that outside of 20% and 30% and the rates are so high for suicide or whatever health issue. But knowing what is driving that, sometimes those numbers don't tell.
And we all do that, in our work. We think of statistics and everything, but it's nice for myself and the people on my team that there's a person behind that statistic. There's a family. And so, I think it's good to remember that.
Right. Awesome.
And that is why it's fun to work in communities, because those numbers and the people behind that mean a lot more.
Yeah. Someone asked me recently what makes me tick about what I do. And I just said, just being in the community. I come alive, and because I value that storytelling. I want to know the motivation behind why someone smokes, We know smoking is bad for someone's health, but they'll tell you, well, no one has died in my family. That's not something we capture.
So what are some ways that, because I do think it's so interesting, we're working all these numbers, and you as a university professor and researcher, I imagine the numbers kind of get a little bit more boggled up. When are times that those numbers have come alive, when you actually made like, that's a person, that's really what's going on in people's lives?
Yeah. Having been trained in that quantitative process where, the emphasis was on numbers and this is what funders want. They want to quantify that. We were just chugging those numbers, the data that I collect. I'm like, okay, 50% of young people in immigrant communities do not have enough knowledge about sexual and reproductive health. But then when I ask them the qualitative questions and I say, tell me, what do you know, and what do you think is standing in between you and that knowledge? And they tell you, well, my family, no one talks about it. Or I'm afraid of asking, or I just go to the internet and learn this. And the numbers didn't say that, And that's when I discovered, which now we're calling it mixed methods, right? It's good. Numbers are great. What they do is they give you a snapshot.
Yeah.
It's like just a glimpse. You take that picture and there's so much more in a picture, And I want the picture to tell the story. And I've learned to now incorporate those focus groups and interviews. And Lord, every time I talk to them, I come out just energized.
And it happens when I do, like, if we have an interview or a focus group and I'm facilitating the focus group or doing the interview, just like the rest of us, we're busy.
Yeah.
And I will be honest, there are times I'm like, I have an interview today.
Right.
But I always, always, always leave that, like, just alive and ready to do my work and work on the community. And it reminds me of why I do what I do.
Yes. And so for anyone who's doubting interviews and focus groups, they're a ton of work. And I've been doing interviews this past spring semester, and there are a lot of them on top of everything else that I'm doing. And I'll be like, same like you. It's on my calendar. Sometimes I'll be doing 5 interviews.
Yeah.
For every one of them, I'm like, oh, I didn't know that. CDC says this, that, and the other. And I have some of that data in my previous research too. And I'm like, that's a new angle, because right now we're trying to come up with a website on various health issues, focusing on this immigrant and refugee youth. And they say, oh, maybe you should consider this and you should consider that. I'm like, I would never have thought, I would have given you a survey, which I will give them a survey, just to know the gaps and where they are in the knowledge.
We have a section in our report, and we're now doing it. Anyways, we do it by health need. It's called Ideas from the Community, and they're great ideas.
Great ideas. Right.
And we're working on making sure that that's kind of seamlessly incorporated into that meeting where we decide the strategies, that they look at the ideas from the community because they're great ideas.
Fantastic ideas. For that project, the website, I'm going out to the communities and asking them what kind of content. I know what content needs to be there, obviously. I know the health issues that are impacting them, and I tell them, here's a range of health issues. Is there something that I'm missing? Is there a topic that you would want to see that's not there? And they tell me, if it's reproductive and sexual health, they have something else about it that they want to learn.
I know. And maybe it's maybe a how you're presenting it. Do you ever run into that where that you want to present of some piece of data, but you learn just by talking to people of sort of a how and what the issues around that is.
And the how in these communities is, can we translate that information? Is there a button that we can press and it produces all these different languages? Because I want that website not to just be beneficial to the young people, but their parents, the healthcare providers, teachers. And I've been interviewing all those folks. And every time I learn something new, and I'm just
and it goes, talking about parents with sensitive topics. We run into that with a lot of communities because there's the OYES survey, and so some communities don't participate. The Ohio Youth Survey.
Oh, okay.
But it is amazing when you just talk. I feel like that's what we're constantly talking about, but it's so true. The magic you might have parents that would opt out, would not let their children take the survey because it asks sensitive questions. But if you talk to them and communicate and explain why it's important, they're all of a sudden the biggest proponents of the survey or your work and, talking to the parents.
Yeah.
And because they want to do well, we don't know.
They don't know. Exactly. That's it. And even religious leaders, I'm part of the folks I'm talking to. And it's, the project is 18 to 25-year-olds. And some of the parents I've talked to or the community leaders who double up as parents, community leaders, and religious leaders, I'm like, can you do that for younger people?
Yeah.
And I'm like, that takes a lot of work. However, the website will be there for them to have access to this accurate information.
So what is kind of the idea? I know there's videos.
Yes. So
Can I explain it?
Yeah, the idea is to provide a source for accurate information, whether it's where do you get clinical services, where do you get tested, where do you get contraceptive information, where do you get mental health.
Is it by community? Because of course you have to know. Or is it stuff online?
So we are leading them, guiding them to how they can find this information in their own community, where they can put the zip code. And so we're giving them resources instead of them having to go on Google. And it's okay, they can Google, but it's like, we have this website, has a plethora of resources and leads you to the Centers for Disease Control and Prevention, leads you to the Ohio Department of Health, the family services that they have. And so we're trying to have like a one area for multiple resources.
And is accurate information too, I'm hearing.
Exactly.
But there's videos too, which I thought was really cool.
Yes.
So tell us about the videos.
So the video that we have that we created, which was the first project that has fed into this project, was I did a study in 2015 with some Somali community, young people in Columbus. And I wanted to know what are the gaps in sexual health knowledge and HIV prevention, and how would they want to get this information. And so they gave me the gaps. And in talking to them, we learned a lot that they didn't know. Some of it was very alarming. And then they asked them, how would you want to get this information for yourself? And so they had a plethora of choices. Could you talk to my parents and train them? Could you talk to our religious leaders and train them in how they can give us this information in a culturally competent manner? We tried that, but I'm young, and sometimes talking to these community leaders from that cultural perspective tends to be challenging. And I couldn't find a medium, someone to go through. And sexual health is a very sensitive topic. So the other option was through videos, through games, through media. And so media, now we're doing the website, and the games, we wanted a VR game that will simulate a young person who's going through all kinds of life experiences, including dating.
Yeah.
And so we focused on the dating part, and what we have is an interactive video. So it's like you watch a movie and you have the captions there, and what the captions are doing is they're giving you they're giving you choices that you can make. So you click on each choice and it shows you how the trajectory.
And there's a video with that choice.
Yeah.
Okay.
And so the video is, we shot videos, we have actors, and they're just simulating what a young person goes through in the dating life, whether they choose to go and spend time with their significant other at home with a Netflix and chill kind of experience, or they're at a club and they're drinking and they're having fun and they meet someone, and the choices that they make. And then when, they engage in this sexual behaviors, and they go to the clinic and they find out they're either pregnant or they have a sexually transmitted infection, how does that go? And so we have these actors acting out the scenarios, and then we have all kinds of decision-making trees. And so when they press one choice, it takes them a different direction. They press another choice, it takes them a different direction. And so they are playing this interactive video like they are that character. And it just shows them what is possible if you choose to drink.
If you possible on your decisions that you make.
Pretty much. And how that can take you a different direction. If you go and someone says, they want to engage in sexual activity, and you say, no, I don't want that. And that takes you to a different choice.
What does it look like?
Yeah. And it takes you to a choice where you say, you know what, I'm going to go home. I'm tired. Or why don't we just do our homework? I don't feel like doing anything else. And it's possible to say no, but it's also possible to say yes, and what that looks like.
But that can look several ways as well.
And that's what we've shown in all, including giving small snapshots of here's what consent means, right? Here's what an STI means. And so we have those PSAs there to provide information, and then they do a survey and they tell us what they learned from that. And that helps us also gather more information. So we're working together with a community-based organization in Commonwealth.
And you're piloting it there, right?
We are piloting it there. ETSS, Ethiopian.
How is it? Because I keep going back to those, back to the parents, back to the community leaders, back to the religious leaders.
Yeah.
Are they using it? Have you gotten feedback? Because that is a big piece of that.
It is. So because we haven't rolled it out widely, we're still piloting so that we see what they're learning first, and if what changes, we've been making changes as we go along.
Yeah.
And so they're so excited. They're like, this should have been done a long time ago. And this is 18 to 25s. And do you have anything for anyone younger? And I'm like, not yet. We'll get there. But once it's rolled out, it's going to be an opportunity for these young people to engage in a conversation with their parents. They can play this interactive video with others. They can do it with, say, Mom, come see what I'm learning, So we're hoping that will be an opportunity to open up those communication.
And that's what we had, what I was talking about with the survey. But again, it can go into so many areas.
Right.
The survey can allow it be an opening for a conversation between a child or youth with their caretaker or their parent.
Correct.
And it can just open up that hard conversation that everybody knows that, that maybe both parties are willing, and they were talking about. It's like how you bring that up.
Yeah.
Yeah.
And for them, they have this thing that is helping them learn on their own without the pressure of having to engage anybody else, the parents or what have you, but also gives them that freedom. If they want to sit down and say, Mom, Dad, come see what I'm learning. Here's this thing. And so it's been a wonderful, wonderful experience.
Yeah, it is what parents can say. Because again, parents want to do well. Yeah. They want to teach their children. Right. They don't know how to talk about things. Right. They also, maybe sometimes everybody doesn't know the correct information to share.
Yeah.
And the way to,
It's been awesome. So as we wind down, tell us your most memorable moment in work and life to date.
Again, I don't have one specific.
Yeah.
But I think that I am thankful that so my work and my life benefits my children, my daughters. And I love, first of all, that I have had experiences that I can share with them. So if I do a trip somewhere, a business trip, I always take one of the girls with me. So my girls have worked in a community in Jamaica, to communities here in the U.S. that we work in. They have been with me. I teach in France on data visualizations. Nice. They've been on business trips.
Wow.
And it's fun for them, but they also see their mother being really excited about her work and talking. If we're driving down a highway and I say, oh, I just did, worked with this community. Yeah. Because that happens constantly. We were down the highway and we see a sign, for somewhere. I'm like, oh, I worked there. And then I tell the girls about it. So they knew that I was coming today to do that. So I think with growing up with, my oldest daughter, I was writing a grant for the Samburu Foundation in Kenya. And it's a long story, but she went there with her dad to install water panels. But it's just, I think just them kind of seeing me excited, seeing me passionate about the work, having opportunities, know that the world is big, and growing up with like a kindness. And if they care about it, I don't know what they'll do in their futures. Yeah. But growing up with that in their lens, to help others and to see their mom that's excited about it, and that we, like to talk about it, and they ask about my work. I mean, when I go home tonight, they'll ask about the podcast and what we talked about, and they're going to listen to it. Yeah. So,
this is exciting. Yeah. I'm so happy. So for anyone who wants to get in touch with you, leverage your services, what's the best way to get in touch with you?
Yeah. So we have a website there, which is great. www.Moxley Public Health. On there is we're making improvements to the website like everybody else, but we have samples of our work, we have our team, We have videos from our internship program. We have monthly lunch and learns that just started a few months ago, and they have been awesome. So we really try to make it so that, because everybody's really busy, so we don't want to talk about theories of things. So for instance, we talked about, here's some things that you can do to identify health disparities in your community. Last month, we did it on data visualization. So I can't remember if there's like 4 things. Here's 4 things that you can do today to improve your data visualization. In a couple weeks, we're going to talk about collaboration and partnership in a community. Here's the things that we have done that you can do today to promote collaboration. So register for those. We are also this kind of new, LinkedIn is our place.
Yay!
And so I have met some great people on LinkedIn. I love it. We have a marketing person that got me on board with it. Now I'm all into LinkedIn. So we are on LinkedIn. So Stephanie Moxley, I have a private page that talks about our company. And then Moxley Public Health also has a page.
And those who are on social media, they are on IG too?
Yes, we are. Yeah, we're on IG, we're on
Instagram,
Facebook. Instagram. But I am personally mostly on LinkedIn, to be honest. That's where I'm comfortable. And so we have the lunch and learns. We have a monthly newsletter as well, so you can register for the newsletter. We promoted You Carry Coffee.
Yes.
The fun thing about public health is basically everything can be public health.
That's what they said.
If it's a Netflix show, it's improving your mental health and work-life balance. So, but drinking coffee really, truly is a thing that it sounds silly, but it makes me happy, and sometimes it's that break, go, having the coffee in the morning, going to meet a friend for a coffee. So I'm excited about Cara Coffee.
I love it. It brings people together. I've enjoyed this awesome coffee and just the value it adds to what we've learned and we continue to learn about my grandfather. And I think that I always want to say the community part of me that I love talking to people and just learning more about them probably came from him. But it's really awesome. And I'm so glad we got to talk and, just see all the synergies that we have. Talk about coffee, talk about public health. Public health is everything, right?
Public health is everything.
You go back to my first podcast, that's what we talk about. Public health is everything. It's everywhere. And it's an exciting field. It's something we do every day. We do public health every day, just in case you didn't know. You drink water, you eat, you sleep. That is public health. And so I want to thank Stephanie for joining me today.
Thank you for having me.
And it was such an exciting moment doing this face.
I forgot actually most of the time that we were doing a podcast.
I forgot too. There's all this recording going on. And I want to thank all of you for joining me today and just for taking your time to follow this podcast and to subscribe to it. And feel free to ask questions. We do have that email address, publichealthmusings2@gmail.com. We are on whatever platform of podcasting that you know about. We are there. So we are looking forward to seeing you if you follow us on YouTube, but also listening to us on Spotify or Apple or whatever. And thank you again for just taking the time to support this podcast and, getting yourself some coffee and listening as you drink this great coffee, and also sharing this podcast with one other person. So thank you. And always remember, public health is everything.
It's everything.
Bye, everybody.
Bye.